All right, everyone, we're back for another case study.
Another case.
And this time we're going to be talking about a really interesting case study.
Yes.
From the Neurohospitalist.
Very much so.
And it's one of these cases that kind of makes you realize that you can't always go by the textbook.
Absolutely not.
Because sometimes the textbook just doesn't quite fit the bill.
Nope.
So in this case, we have a 50-year-old male.
Okay.
With a history of intravenous drug use and HIV.
Oh, right.
And he presents with gait instability and falls.
Okay.
Sounds pretty routine, right?
Yeah, you would think so,
but think so.
The initial neurological exam was normal?
Yeah, that's the really interesting thing here.
Right.
Is that like the initial neurological exam
it's completely normal.
Was totally normal.
No focal deficits, no cranial nerve abnormalities.
Yeah, so they could have just sent him home and said, take it easy.
Right. But thankfully, the medical team wasn't satisfied with that and decided to dig a little deeper.
Okay, so what did they do next?
Well, they ordered imaging studies.
Okay, I'm seeing a twist coming here. What did the imaging show?
Yeah, so both the CT and MRI showed multiple brain lesions.
Oh, boy.
So now we're getting into a little bit more concerning territory.
Yeah, because now you got to think infection malignancy.
Exactly.
Something more exotic.
Right.
So multiple brain lesions in a patient with a history of IV drug use and HIV.
Yeah, what are you thinking?
Well, I mean, lymphoma's got to be pretty high on the list.
And dengue.
Right.
Yeah. And to make matters even more complicated, the FDG PET scan, which is often used to evaluate for lymphoma, showed increased uptake in these lesions.
So they started him on chemo?
No, not so fast.
Oh.
This is where we emphasize the importance of thorough investigation.
Okay.
So before jumping to conclusions, the team ran a battery of tests to confirm or rule out a cryptococcal infection.
Cryptococcal infection, that's not something you see every day?
No, especially presenting like the...
Yeah, especially with multiple brain lesions.
Exactly.
So did they find evidence of cryptococcal infection?
Well, that's where the case takes another turn.
Yeah.
All the initial tests for Cryptococcus came back negative. The serum and CSF cryptococcal antigen.
Wow.
CSF, PCR, even cultures.
So all negative.
All negative.
So you've got this patient with concerning lesions on imaging.
Right.
A clinical history that points towards infection. But all the specific tests are negative.
Yep.
What do you do?
This is where clinical judgment comes into play.
Okay.
Despite the negative test results, the medical team had a strong suspicion for an unusual presentation of cryptococcal infection.
Okay.
And decided to proceed with a brain biopsy.
A brain biopsy? That's a pretty invasive procedure.
It is.
What made them so sure it was the right call?
Well, they considered all the other possibilities and weighed the risks and benefits.
Right.
The imaging findings, coupled with the patient's history, just didn't add up. And they knew a biopsy was the only way to get a definitive diagnosis.
And what did the biopsy reveal?
It confirmed their suspicions.
Oh, wow.
The biopsy showed multiple cryptococcomas.
Cryptococcomas?
Which are essentially granulomatous masses that can form in the central nervous system during a cryptococcal infection.
So not lymphoma after all.
Nope.
This case is full of surprises.
It is.
But wait. Didn't you say earlier that cryptococcal infection is more common in people with healthy immune systems?
I did.
This patient was immunocompromised.
Right, and that's one of the things that makes this case so unique.
Yeah.
It seems like this patient's immune system was in this sort of Goldilocks zone.
Okay.
Not too strong, not too weak.
Interesting.
Allowing for the development of these unusual cryptococcomas.
A Goldilocks zone for infection.
Right.
That's fascinating. But before we dive deeper into that, let's take a step back and talk about cryptococcomas themselves.
Okay.
What are they exactly?
Right.
And what makes them so challenging to diagnose?
Good questions. Well, think of cryptococcomas as these sneaky little masses that can pop up in the brain or the spinal cord during a cryptococcal infection.
Okay.
They're basically the body's attempt to like wall off the infection.
Okay.
Kind of like building a fortress around these invading cryptococcus organisms.
So these cryptococcomas, they're like little bunkers.
Yeah.
Protecting the cryptococcus from the immune system.
Right. And that's what makes them so tough to diagnose.
Yeah.
They can mimic a whole bunch of other conditions on imaging. You know, you see this on a scan and you could think, oh, is this a brain tumor? Is this an abscess?
Right.
Could this even be something like multiple sclerosis?
Wow. So if the imaging isn't clear-cut,
right,
and the standard tests for Cryptococcus come back negative.
Yeah.
How do you catch these Cryptococcomas?
That's where a high index of suspicion becomes absolutely crucial.
Okay.
You have to consider the whole clinical picture of the patient's history, their immune status, any exposures they might have had.
Okay.
And sometimes, like in this case, a brain biopsy is the only way to get a definitive answer.
This case really underscores the importance of not dismissing those nagging doubts,
Yeah.
even when the initial tests seem reassuring.
Absolutely.
But let's go back to this Goldilocks zone you mentioned.
Okay.
What's going on there immunologically?
It's a bit of a puzzle, but it seems that in this patient, his immune system was suppressed.
Okay.
Enough to allow the Cryptococcus to gain a foothold.
Okay.
But not so suppressed that it couldn't mount some kind of response.
Okay.
And that response, instead of clearing the infection, resulted in the formation of these Cryptococcomas.
So it's like his immune system was trying to fight back.
Right.
But ended up inadvertently creating these protective havens for the Cryptococcus.
Exactly. It's a rare scenario.
Yeah.
But it really highlights the complex interplay between the immune system and these opportunistic infections.
Fascinating stuff. Now we know that the initial tests for Cryptococcus were negative.
Yeah.
In this case.
Mm-hmm.
Could you walk us through those tests and why they might have missed the mark?
Yeah, so the mainstays are going to be the cryptococcal antigen test, which looks for specific proteins shed by the organism, PCR, which amplifies the Cryptococcus DNA if present.
Right.
And then we also do cultures to try and grow the organism.
So why didn't those tests pick up the infection in this patient?
Well, we have to remember that no test is perfect.
Okay.
One possibility is what's called the prozone effect, where very high levels of the antigen can actually interfere with the test and cause a false negative.
So that's almost counterintuitive.
Right.
How can having too much of the antigen lead to a negative result?
Yeah, think of it like the test relies on a very specific binding reaction between the antigen and the antibodies in the test kit. If there's a massive amount of antigen present, it can overwhelm the antibodies, preventing that crucial binding from happening.
I see.
It's like trying to fit 1,000 people into a phone booth.
Okay.
There's just not enough room for everyone to connect.
That's a great analogy.
Yeah.
So basically the test gets overloaded with antigen.
Right.
And can't function properly.
Exactly. Another possibility is that those encapsulated Cryptococcomas we talked about earlier were sequestering the organism, making it harder to detect in the blood or CSF.
So not only are they hiding from the immune system, they're also potentially hiding from our diagnostic tests.
Exactly. Talk about sneaky.
Yeah, that's pretty sneaky. And we also can't rule out the possibility that this particular strain of Cryptococcus had a reduced or absent capsule, which would throw a wrench in the antigen test as well.
Absolutely.
So even with our sophisticated diagnostic tools, sometimes the bugs can still outsmart us.
They can.
What are the key takeaways here for clinicians on the front lines?
I think this case screams the importance of maintaining a high index of suspicion for cryptococcal infection. Even when initial tests are negative. Early brain biopsy can be life-saving in these situations.
And never underestimate the complexity of the immune system.
Yeah.
This Goldilocks zone concept is a powerful reminder that we need to consider the whole patient, not just their lab results.
Absolutely. Now let's shift gears and talk about treatment. Thankfully, our patient responded well to antifungal therapy. But there are some important nuances to keep in mind when managing cryptococcal infections.
Let's dive into that. What are the go-to treatments for cryptococcal infection? And are there any special considerations for cases involving Cryptococcomas?
Yeah, the first-line treatment typically involves a combination of amphotericin B and flucytosine, followed by consolidation therapy with fluconazole. But with Cryptococcomas, we sometimes need to think outside the box.
Thinking outside the box, what do you mean?
Yeah. Well, in some cases, those Cryptococcomas can cause significant mass effect, putting pressure on the surrounding brain tissue.
I see.
So in those situations, surgical intervention might be necessary to debulk the lesions and relieve that pressure.
So it's not just about treating the infection, but also managing the potential complications caused by these space-occupying lesions.
It's a multidisciplinary approach, often involving infectious disease specialists, neurologists, and neurosurgeons, all working together to provide the best possible care for the patient.
This case really emphasizes the need for a collaborative approach
Absolutely.
Especially when you're dealing with such a complex and potentially life-threatening condition.
Communication and coordination among specialists are absolutely crucial.
Yeah, I think that's a really important point.
Yeah.
So as we wrap up this incredible case, what are the big takeaways for our listeners?
I think the biggest lesson here is the importance of maintaining a high index of suspicion for cryptococcal infection, especially in patients presenting with atypical neurological symptoms, even if those initial tests come back negative.
It's a reminder that those tests aren't foolproof.
Right.
And we can't rely on them solely.
Nope.
We need to consider the whole clinical picture.
Absolutely.
And sometimes a brain biopsy is the only way to get that definitive diagnosis.
Sometimes it is.
And don't forget about the immune system.
Right.
This case highlights the incredible complexity of the immune response.
It does.
And how it can sometimes play a role in the development of these unusual cryptococcomas.
This Goldilocks zone concept.
Right, the Goldilocks zone.
Is fascinating.
Yeah.
And it's a reminder that we need to consider the patient's immune status, not just their lab values.
Right.
When evaluating these complex cases.
Very well said. This has been an incredibly enlightening discussion.
It has.
Many thanks for taking the time to break down this complex case.
My pleasure.
And share your insights with us.
Of course.
For our listeners, be sure to check out the full article in the Neurohospitalist.
Yes.
For a deeper dive into this fascinating case.
A lot of great information in there.
Yeah. It's well worth the read.
Absolutely.
And don't forget to share this episode with your colleagues.
Knowledge shared is knowledge multiplied.
That's right. And as always, you can find a disclaimer and bibliography in the description.
Indeed.
Thanks for tuning in, and we'll see you next time for another fascinating case on The Deep Dive.